This is Tammy Pozerycki for our show called Mental Health Wellness, A Journey in Healing. And I am from Westboro Behavioral Healthcare Hospital. And we talk about issues regarding mental health wellness. And hopefully you'll find this program educational. And I want to introduce you to my two guests. Shannon Radford, who is a licensed clinical social worker, is one of our clinicians at Westboro, and Jared Perry, who is also an MSW and licensed social worker, working with our adolescents program at Westboro. So welcome, both of you. Thank you so much for being here. And I thought we could start the conversation out about just tell us who you are and why you decided working with adolescents was something you wanted to do. You want to start, Shannon?
Sure. So I got my bachelor's degree in social work, and I worked with adolescents while I was getting that. I worked at a CBAT, which is a community-based acute treatment program, then at a middle school. By the time I got my master's degree, I was working at a community mental health center, and we worked a lot with adolescents. I think that's a population that's really in need right now, and they can be a difficult population to work with a lot of the time. So when the opportunity came for me to work at Westboro and take the lead clinician role of the adolescent program, I was excited to do that.
Awesome. Well, we're happy to have you too. And Jared, a little bit about your background.
Sure. So I earned my bachelor's of social work back at Indiana Wesleyan University. And then I went on to grad school, got my MSW. I started practicing with gender nonconforming youth at a clinic that works specifically with trans youth. I then went on to work in a community health clinic where I worked with people with serious mental illness, in addition to I did a little bit with addictions and substance use.
So what do you both, and I'd like to have both your opinions on what you're finding as some of the larger issues affecting the mental health of our adolescent population?
I think, mostly what I've seen recently has been issues related to anxiety, dealing with the pandemic, coming out of social isolating, returning to school, returning to work. I mean, that's been huge issues that the economy's been facing. But overall, I think that's been the primary issue we've seen. I mean, obviously at Westboro, we work with kids who are struggling with depression, anxiety, just various issues. But I think primarily it's anxiety and depression that we've been working with.
How about you, Shannon? Do you see anything other than that affecting your clients, your patients, depression, anxiety? Do you see suicidal ideation?
Yes, I see that a lot, and I come from a trauma background and an attachment-oriented background, so I think that both attachment and trauma play a role into a lot of the symptoms associated with anxiety and depression. And I think that the pandemic really impacted connection and socialization for a lot of the adolescents, and I'm also noticing that because of that lack of socialization, now they're going back into schools. There's been an increase in arguments and fighting happening in the schools. Kids are struggling to regulate because they never had to do it before, because for 2 years they were doing virtual learning, a lot of them.
That's interesting to hear the word regulate, because as a layperson, I don't know what that means. When you say helping them to regulate, or I would assume that's the opposite of dysregulation. Can you guys give me an example of that? What does that mean?
When I think of dysregulated, I mean, we all experience big feelings, right? Whether that be anger, sadness, anxiety, those are big feelings. With dysregulation, whenever a person becomes dysregulated, they're experiencing those big emotions, those big feelings. It's kind of like going from one opposite to another. And what we want to do is to attempt to find that middle ground where a person is balanced, or in other words, kind of self-regulating.
Interesting. So it's almost like a pendulum swing. You know,
I
if
would
they
say
get to
so.
the side extreme of whether it's real big anger feelings or real big sadness feelings, what you're trying to do is to calm and get them to a well place, right? So I'm going to just tell the audience a little bit about Taking Shape. Taking Shape is a partial hospitalization program or a day program for adolescents aged 13 to 17 to come every day and work on getting well. And what does that mean? Their day includes group psychotherapy and psychoeducation, and we have other enhanced modalities, which we'll get into. So what is the difference between, like, what is a psychotherapy group in comparison to a psychoeducation group that you do with the adolescents who come to program?
I think, at least with my group, I guess every clinician really has their own approach with how they do psychotherapy and how they do psychoeducation. In my approach with psychotherapy, I look at it as an opportunity to work directly with the clients and them offer feedback. It's their time to be able to connect with me, even if it's in a group setting, to actually hear their story, maybe hear about what's going on. I myself work a lot with CBT, or cognitive behavioral therapy, which is all about challenging thinking, looking at perceptions, looking at perspectives of other people and the world around us. So, it kind of gives them an opportunity to be able to communicate to me some of those perceptions and perspectives, and also is an opportunity for me to challenge some of those.
And how about you, Shannon? What would you say for your groups that you run? What is your description of what your psychotherapy group looks like in comparison to psychoeducation?
Yeah, so I feel like I've actually gone over this a lot because we've gotten a lot of new kids recently. I explained to them that psychotherapy is more like a process-oriented group. So I don't come with an agenda. I don't come with anything to teach them. We're all just we're sitting down and everybody has a chance to check in. They talk about their mood, how they were doing the previous evening, if they had any struggles, and it's an opportunity to receive feedback not only from me, but from the group. And I think that's really valuable, especially for adolescents. I think it's easier for them to hear a lot of these things from someone their own age. Psychoeducation I describe as more kind of like a classroom. Mm-hmm. The clinician usually comes in with a topic that they're going to talk about or teach, or maybe a coping skill that they'll practice, an expressive arts activity. And at that point, we're kind of engaging them in a little bit of learning and processing as we go through that.
Do you find that adolescents, it's interesting to me that you have a lot of adolescents come and do groups because now they're forced to be with other kids. Mm-hmm. But I've also heard that groups can be much more effective than the individual therapy. Mm-hmm. What challenges do you find with getting the kids to be comfortable in a group setting? I would think that would be challenging.
I think in a lot of settings where adolescents have to work with peers, it can be very anxiety-inducing, I guess is what I'm trying to say. Like the school environment, that can be really, that can make them really anxious. And I think whenever you tell an adolescent that they're going to be doing group therapy or something in a group, it kind of induces those feelings of anxiety. But oftentimes, once they get their foot in the door and once they try it, I found that honestly they like the idea. I was talking with them about it today, and most of them said, I like being able to hear feedback. I don't feel like it's as awkward with, a group of people as opposed to two, because you think in individual therapy, it's you and the therapist. To kids, sometimes that can be a turnoff, whereas, being in a group setting with peers makes them much more comfortable.
So If I were a parent and my child was struggling in school, depressed, anxious, I don't like the way that the terms that are used in outpatient, like when I hear partial hospitalization program, you think real hospital stuff, right? And I think the term day program kind of helps ease that a little bit. I think the verbiage of partial hospitalization program. Do you find any parents to feel that same way? Like they're scared of what am I putting my child in?
I don't know if I find that happens so much. I think with the partial hospitalization, because at that point they've usually been either in the hospital being assessed, like they're either stepping down from inpatient a lot of the time. So they've been exposed to a higher level of care. And I think that a lot of parents can be a little bit maybe skeptical of mental health treatment in any way, shape, or form. But I'm not sure if the term has caused any anxiety with parents. What do you think, Jared?
I think that, I've had some parents question, the structure of the program, what it is, but I don't think the terminology so much scares them. By the time, like what Shannon said, by the time they get to us, usually it's a step down from inpatient. So a lot of times families are very well acquainted with, mental health treatment settings. So I've not found that so much to be an issue, but I definitely see your point, how that can seem very clinical. There's a thing called white coat syndrome, and I think even whenever you hear the word hospital, it can be intimidating. But I've not really had that issue with parents or patients, really.
I think too, what I think I'm seeing out there in the community is that people are starting to decrease the stigma of mental health treatment a little bit more. So I see like adolescents be the generation to say, it's good to get mental health treatment, So how do you know when someone starts the program, you're constantly working on goals, how do you know when they're ready to graduate? What determines that?
A big proponent of treatment at Westboro, and I think any established treatment, is really having person-centered care. So because partial is a shorter term program, we start the conversation about discharge right from the beginning. And I start that with the adolescent and with the parent, because I think it's important that they have a say in what's going on. So generally, we'll set a date at the very beginning. Most folks are there between 2 and 8 weeks. And then we reassess every week. We say, how are things going? Do you feel like you're making progress in the program? Is treatment working for you right now? Is there anything that we can do to change things around? And so I think it's a constant evaluation process, checking in with the parents. How are things going at home? Are we feeling ready to go back to school? And I think something that's cool about our program is that they can start transitioning back to school, and then so they can go to school a day and then come back to our program and kind of process how it went, go through any difficulties they might have experienced with the group. And it makes it a little bit less scary, because going to a partial program is a complete shift in routine for anyone.
Right.
I think even the first couple of days people come in, they feel very overwhelmed. It's a whole new setting, a whole new group of people. They don't know what to expect, and it can take a little bit to feel acclimated, and that's just a normal human response or reaction that even neurotypical folks have. So
I like the term, you talked when you were introducing yourself, you said non-conforming youth in terms of sexual identity. And so are you seeing that more in practice at in taking shape in the program? Are you seeing that?
Yeah, there are quite a few clients or patients who who I would consider gender nonconforming, who are still in the process of exploring their gender identity, kind of figuring out who they are. I mean, that's kind of what adolescence is. You're forming identity,
Right.
you're forming perceptions, beliefs. And I feel like gender nonconforming youth, that's exactly what they're doing. They're trying to figure it out.
That's awesome. And you're giving them the support they need to do that.
Absolutely. Absolutely. And support in using their preferred pronouns, preferred name.
So could you, if one of you wouldn't mind taking a stab at the fact of, I'd like parents out there or anybody who's listening, I would ask the question, what's it like for the adolescent? So the adolescent, what does the adolescent's day look like? Like when they get there, they are dropped off, they arrive. What does their day look like? You want to?
So each group has a little bit of a different schedule.
Okay.
I know with my group specifically from 9 to 10, they do what is called school, where they get an opportunity to work directly with a teacher or tutor on homework that they may need to work on in order to keep themselves caught up with school. And then from 10 to 11, we do psychotherapy. Where, like I said earlier, they get a chance to talk with me kind of individually, but in a group setting. And then they go to what is called occupational therapy wellness, where kids are able to access a gym and get exercise, also work on life skills. And after that, they do another session of psychoeducation. Where we teach a coping skill like what Shannon described earlier. And then there's a third psychoeducation session. Sorry, I'm trying to keep this straight. Then they have a third psychoed. That's the third session, which is a psychoeducation session. And then they do lunch, then they come back. And we also do a wrap-up sheet where they get an opportunity to check in at the end of the day just to get an idea of where they're at.
I love that you brought up the whole academic part of it, because a lot of parents are concerned with that. How much school are they going to lose? And we're fortunate at Westboro to have Learn Well, which is that academic tutoring service that is able to work with them. How different is your group?
I think the only thing that is different is that my group has psychotherapy right when they come in the morning. So they have psychotherapy from 9 to 10, 10 to 11 is tutoring, and then same schedule from there. So 11 to 12 wellness, 12 to 1:20 is psychoed. And I know different clinicians do that a little bit differently. Like I usually do one topic and just focus on that topic really in depth and do that for like an hour and 20 minutes. Some people cover 2 topics during that time, then they go to lunch, and then we have about a half hour when they come back, and at that point all of us do wrap up, which is kind of just talking about how are you feeling going home, are you feeling safe, what are your plans for this evening, maybe get some feedback from peers of like maybe what coping skills can you use if you're feeling dysregulated, if you have something stressful coming up.
It's interesting you say feel safe, and I've heard the term like almost like a safety plan or a safety contract, or something where you folks feel that your kiddos are going to go home and be okay. Tell me what that looks like. So say you have an adolescent who has expressed suicidal ideation. What is a safety plan? What does that even mean?
A safety plan looks at triggers, looks at warning signs. It's kind of a preemptive measure that can be used either by the adolescent or their parent. A lot of times when kids do get so dysregulated, they can't access their logical, rational brain. Yes. So if they have a safety plan, they have their coping skills listed out right there. Like they don't have to think about it. It's just what can I do right now? Who can I reach out to? And I think it's particularly helpful for parents and caregivers because I always like to go over, like, what can other people do when you're feeling this way? And I think a lot of parents and caregivers want to know. They want to be helpful. They want to be supportive. But usually in that moment, the adolescents are not able to express what they need. So thinking about that beforehand can provide a little bit of insight to the parents moving forward.
One of the things I wanted to bring up was what I've heard called the silent epidemic, which is youth suicide. Westboro Behavioral has partnered with what's called the Jason Foundation. And the Jason Foundation is a nonprofit organization that provides education, awareness, and just bringing about the fact that youth are struggling with all kinds of issues. So part of the Jason Foundation efforts are that myself as a rep of Jason Foundation to go out to schools, to go out to teachers, parents, students, and educate on the signs. And because what I do see is that most youth suicide is preventable if we pay attention. The gentleman that started the Jason Foundation's name is Clark Flatt. And his son, Jason, was 16 when he took his own life. And there were no signs, you know. Clark said he played football and he got great grades. He had a group of friends. And I think that's kind of a scary thought for parents because a lot of parents out there think their kid's doing okay. So when do you think someone should actually consider attending a program like Taking Shape? When is it time? Yes, they've had anxiety. Yes, they may have depression, but maybe they have a therapist who they see weekly. Maybe they're on some medication. What would be some of the things that a parent may see or hear or say, oh, you know, maybe we should look into this Taking Shape program. So I guess that's what I'm looking for to offer to parents. When might it be time for them to look into something like this?
Sure. So usually the kiddos who are coming to us, the school has noticed something is going on. So we could notice like a decrease in functioning either at school, which could look like not going. Like a lot of them have difficulty even getting to school, but also failing grades, kind of not an ability to engage in care tasks. So maybe they struggle getting out of bed, taking showers, brushing their teeth. I think just a noted decrease in functioning. And if they have an outpatient therapist already, I think that's always a great place to start. Maybe if you're a parent, talk to the outpatient therapist a little bit and say, like, I'm noticing a pretty significant decrease in functioning. What do you think? And some therapists may say, you know what, let's do therapy twice a week and maybe try that for a little bit. And then if that doesn't work, usually that would be a sign to come to a partial program. And I think our goal in a partial program is to get them to a better space. So we want them to be able to function in the community to continue to do the work. So what I tell the kids often is that, like, you're not going to leave this program completely healed with all of your problems solved. That would be great. But unfortunately, that's not the way that healing works. So it's a short-term stabilization program. So it's to get you to a place where you're at least able to get to school, where you're able to get to therapy, where you're able to be safe enough in the community to do the work that you need to do long-term.
That's an awesome explanation. Is there anything you want to add to that, Jared?
No, I think Shannon said it perfectly. You know, you want to catch the mental health issues before it gets to start, you know, before the adolescent starts considering suicide, right. Or having that suicidal ideation. So yeah, no, Shannon said it great.
I want to bring up substance use, alcohol, marijuana. Vaping, that's a big deal. Are you seeing a lot of that?
I know that I'm seeing it a lot with kids in my group.
Yeah, I think it's, I've seen it quite a bit with a lot of the patients that I'm currently working with who are just struggling with substance use, like vaping, using marijuana, things of that nature.
And I think what adolescents don't understand is that their brain is not fully developed. And so when they are using substances, I mean, maybe it's just my opinion, but I would think it's really detrimental for an adolescent to be using any type of cannabis, just because of that. Do you agree with that? That because their brains aren't fully formed yet?
This is interesting because I was talking about the adolescents today about brain development and like how trauma impacts brain development and mood and functioning. And they were talking about how a lot of parents, how a lot of caregivers, how a lot of teachers and staff, they hate it when people say, your brain is not developed yet. You're going to change the way that you view this when you're older. Like almost anything that anybody says right after that sentence, they immediately shut out. I don't know if you've noticed that in your group too.
That's a riot. So adolescents, that is something we just don't say. That's a big learning curve.
Well, I mean, you can say it, but I think that what happens is they
shuts them
immediately,
off.
because what they hear is that their experience is invalidated, is that you don't understand. You're saying that I'll change my mind when I get older. And I think that for the people who are saying that usually mean that like it gets better, because it does.
Right.
But again, because their prefrontal cortex is not fully developed, they can't understand the nuance of that.
Interesting.
So
it's like
almost
when your parent used to say, wait till you have kids,
Yes. Yeah.
You really get to understand what it's. I feel from when I grew up, from when I raised my kids, adolescence is just so much more difficult for kids now. Social media, bullying. You had mentioned the bullying factor in social media. That seems to be.
I mean, it's a huge issue. I think that's where a lot of the bullying comes from today. The adolescents' experience is the social media bullying. In fact, a lot of them, fortunately, they remove themselves from social media and kind of place a barrier between them and experiencing that trigger. So.
Well, I want to thank you both for being here. I know, being on camera is something new for you, but you did great. Both of you did great, and I really appreciate you being here. And I really appreciate the work that you're doing with our adolescents. They're very fortunate to have you both. I'm going to give you our number for if you are interested in learning more about the Taking Shape program with Jared and Shannon. Our intake number is 508-329-6412. And if you just want to call and ask some questions, but it would be something to think about if you feel that you know an adolescent who seems to be struggling. Is there anything else you guys want to add that we haven't discussed?
I don't think so.
No.
All right, wonderful. Thanks again. Thank you for being here for our mental health wellness program, A Journey in Healing, and we'll see you next time.